Today we will talk about epidural hematoma. We will go through by definition, symptoms, diagnosis, how we will diagnose the epidural hematoma, after that treatment, and the last one will be the complication. The epidural hematoma is an emergency condition that will need treatment as soon as possible. We will define as a collection of blood between the skull and the dura mater. Dura mater is the outer layer of meningeal layer that covers the brain. We will see our cranial layer. First one will be the skin, after that periosteum, cranium. Cranium is a bony part of the skull, and we will look the meningeal layer. Dura mater is the outermost layer, as very thick and very strong. The arachnoid matter is middle layer, and the inner one will be the pia mater. The epidural hematoma form between skull and the dura mater is mostly between here. After that, we can look for pterion. Pterion it is a junction between skull bone like frontal bone, parietal bone, temporal bone, and the last one is sphenoid bone. In the junction between these bones, the middle meningeal artery passes through the pterion. When there have injury to the head, is mostly there will causes the injury of the pterion. That will causes the rupture of meningeal artery. The meningeal artery will bleed between the skull and the dura mater. That will collection with the blood that will causes the epidural hematoma. After that, we can go for symptoms. Symptoms will be the confusion and dizziness, nausea, vomiting, and the main important symptoms will be the lucid interval that from minutes to the hours. If there have head injury or trauma, the patient will loss of conscious a period of time. After that, the patient become conscious, and then rapid deterioration back to the unconsciousness. That is the main important symptoms for diagnosis of epidural hematoma. There also have drowsiness and altered level of alertness. The pupil will be fixed and dilated ipsilaterally. If there have injury left side, the pupil will dilate the right side. There will have headache severely. After that, we can make the diagnosis by do the non-constant CT scan, or we can do MRI, but MRI we do not do because it's expensive and there need more time to do that, so we prefer to do the NCCT and we make the diagnosis. For NCCT, we look for there will have the hyperdense biconvex shaped or lenticular shaped lesion, hyperdense lesion that will show is epidural hematoma. After we make the diagnosis to use NCCT and the symptoms, then we will go for treatment. Treatment will first we treat symptomatic, like if there have head injury, there must be the cranial hypertension, then we give the mannitol. If the BP is increased, then we give the antihypertensive drug, or we can symptomatic treat. What the patient have symptoms, we treat accordingly. After that, for definite treatment, we can go for neurological evacuation like burr surgery or craniotomy. After that, the complication will be the patient may die because of brain herniation or arterial bleed of meningeal artery. That will be the secondary causes. Thank you guys. This is the medical information video.